Hello and welcome. Today, we are discussing some important new developments affecting home health, hospice, and wound care providers nationwide. So, CMS recently announced a major 6-month moratorium on new enrollments for hospice and home health agencies as part of an aggressive effort to crack down on fraud. And I'm sure, hopefully, you've heard of this, but to help us understand what's happening and what it means for your patients and your providers, we're joined by two experts. Julie Rhodovi, representing the Alliance of Wound Care Stakeholders, and Jeanine McGuire from the Post-Acute Wound and Skin Integrity Council, otherwise known as PAWSIC. Thank you so much for joining me today.
Thank you so much for having us.
Thank you.
So, Julie, I'm going to start with you. CMS just announced that 6-month nationwide moratorium on new enrollments for home health and hospice providers, especially targeting those fraud concerns, which I think we've heard about over the last year, especially. Can you just share a little bit more about what these involve and why CMS felt they were necessary at this time?
Yeah, absolutely. So the implementation of the moratoriums is really just a temporary stop to any new hospice or home health agencies from enrolling in Medicare. And the goal of this was to really prevent bad actors, those that are committing fraud and abuse in the system, from entering this space. The space of vulnerable patients and the taxpayer dollars, and really ensuring that these spaces are not being exploited. This decision followed after a lot of data and investigation, really showing that fraud in this sector is very deep. And CMS really felt that they wanted to halt any further home health agencies or hospice agencies from coming in and giving them the opportunity to really dig deep into the providers that are within this space right now.
Yeah, sure. I think anytime people see an opportunity to make money and you see a large influx of organizations trying to join in on that, it definitely makes sense. But are there specific concerns that CMS is really trying to address? And how are they also ensuring that the patients are still going to get the care that they need while halting new agencies from coming in?
CMS's primary focus is to stop fraud, waste, and abuse. And unfortunately, what they're seeing is that this is widespread along all hospice and home health agencies and not in one corridor. It becomes really important within the space. This is enhancing oversight with site visits and background checks and data analytics to protect both the patient and the program integrity. So those home health agencies and hospice agencies that are working today and continuing to service those patients will have that oversight and ensure that they are still doing their job every single day the right way to take care of those patients.
That sounds like a win for our patients. Jeanine, from a post-acute wound care perspective, what ripple effects would you expect from these changes, especially for the mobile wound care providers that are still out there?
The first effect to think about is the potential for access issues with this vulnerable population. And what it comes down to is this: we know that most chronic wounds are truly just the physical manifestation of people with multiple chronic conditions that have not been well managed, and or also those at the end of life. And both of those populations are getting bigger with aging and with compounding chronic diseases and polypharmacy. So putting a halt on these programs has the potential effect of causing some bottleneck, which means access issues for probably the most vulnerable populations. So that's something to certainly raise a flag and be concerned about. But at the end of the day, as Julie said, the intent of this moratorium is really to protect the integrity of these programs. So from my perspective, from the perspective of PAWSIC, this is an inflection point. This is a time for introspection, because even without the halt of these programs, the reality is this particular population, it doesn't matter whether it's home health or hospice, at a global level, chronic wounds are increasing. Within the US, litigation is increasing. Regulatory fines are increasing. The education and academia is not. None of us, whether we're nurses, therapists, or physicians, are prepared to manage this population. So really the call to action here is look at your program. How can you do process improvement right now? Because the challenges with this population are only going to escalate. So this is a moment in time, and it's a call to action to stop and do self-evaluation and determine how can you improve. And wound providers, mobile providers can be part of the correction here. They can be part of the improvement plan. And that's what I would ask everybody to ponder is how can we work together and collaborate to have better outcomes for our patients?
So what should hospice or home health agencies that are already in the market do right now in order to keep providing that quality wound care in order to stay compliant? Like you said, this is a time for self-evaluation. So what type of self-evaluation and what tools are there to do that?
I would start with a couple of things. First, you want to look at the literature and understand what I just said about the increase in chronic wounds. This is a tidal wave that's coming at every single setting. So acknowledge that reality. Second, this isn't a specialty yet. Maybe it will be in time. But that being said, recognize that a physician, a nurse without specialized education, they're not going to be able to necessarily lead your program. So find somebody who is wound certified from an accredited agency and make sure that they have a background of systems approach so they can help lead your QAPI program, your process improvement program. You need to understand what your metrics actually are, but keep in mind, even in the best of best, misdiagnosis of wounds is still 30 to 40%. So you want to really do everything you can to get your arms around where are you really at today. Increase the culture of transparency, bring in imaging, photos, make sure it's all HIPAA compliant, but you have to know where you're actually at if you want to figure out where the heck you're going to get to. So really figure out your ground truth. You can lean on a lot of different organizations. You can certainly lean on PAWSIC. We have free education for wound basics. We have a QAPI program coming out. And our 2022 wound provider checklist is now called the Mobile Wound Group Checklist. It's coming out in June. It's 2026 version. And you can use this no matter what setting you're in to really vet that mobile wound group to make sure that they're matched to meet your needs. And if you're a mobile wound group, use this checklist to make sure you're ready to meet those needs. I would start there.
And can you just remind our audience where you can find that checklist online?
Yeah, absolutely. You can go to pawsic.org, PAWSIC.org, and you can join for free and download those resources. The newer checklist won't be available for a few more weeks, but the older one can still be a good starter point. But
Great.
That's where you can get all of these resources.
Great, thanks. And
Thank you.
then I know Jeanine has given us kind of her call to action. So as a takeaway, Julie, what is your takeaway message or your call to action for providers and patients given this crackdown?
Yeah, that quality, that call for action is really about quality and integrity and really doubling down on those things. And Jeanine said it so well. And at the end of the day, what we need to make sure is that we're doing what's right for the patient. And when it comes to our regulations and getting through things like audits and structure, we want to make sure that documentation is done properly and that the patient is receiving what they need and getting what they need. And therefore, the provider, the home health agency, the hospice is getting their payment and what they need in that structure. So really making sure that your agency has everything buttoned up when it comes to what you need for education. When it comes to wound care specifically, this is a very intricate space of healthcare. And the documentation that's required in this space of home health and hospice has a lot of different pieces to it. So really understanding those pieces and educating yourself on that, making sure that you have what you need, going to different resources to find out what's happening in the audit space of home health, which you can find on cms.gov. With the OIG, there's lots of really good information to know what's happening in that space. Because if you are an agency that is having an audit, you need to understand what that entails. You need to understand what they're going to look at so you can be totally prepared. So your quality and your integrity as an agency becomes very important. The Alliance of Wound Care Stakeholders is really here to support wound care providers, agencies, alliances, associations throughout our community. And they're really there to advocate in that space. When it comes to this particular regulation and this moratorium, we're here to support you in education that you might need or push you towards the right space to do that education. And at this point, what your very best bet is to really make sure that you have everything that you need in line within your agency so that when and if audits do come, you know exactly what to expect and you're prepared for those.
Great. Thank you so much for sharing those resources and your knowledge and expertise today. And thank you so much to PAWSIC and the Alliance of Wound Care Stakeholders for sharing this with the audience of the Frank and Lizzie show. And of course, hopefully your audiences as well. And as always, feel free to share and subscribe to the Frank and Lizzie show for the latest updates in wound ostomy and lymphedema care.